Evaluation of circulation forms a critical part of your initial assessment. If blood is not adequately circulated, some of the cells and organs in the body will not receive an adequate supply of oxygen, and dangerous waste products will begin to build up. If the problem is not corrected, shock will occur. Severe bleeding or hemorrhage is one of the most common causes of shock. Signs of shock include restlessness or anxiety, pale, cool, and/or clammy skin, nausea and vomiting, tachycardia and tachypnea, and as a very late sign, hypotension. Take BSI precautions. This is important because there may be direct contact with possible blood-borne pathogens. Use gloves and goggles at a minimum, a gown for gross hemorrhage, and a mask or face shield for spurting blood. Expose the wound and estimate the amount of blood lost by the patient. Apply firm direct pressure to the wound with a gloved hand and gauze pads or other dressing material. Bleeding from a neck or chest wound should be controlled with an occlusive dressing that prevents any air from entering the wound site. Occlusive materials include any non-breathable substance, such as a gloved hand, Vaseline gauze, or plastic wrap. If bleeding is controlled and does not seem to be seeping through the bandages or coming up through your fingers, then bandage the dressing in place with roller gauze, elastic bandages, triangular bandages, or cravats. To ensure uniform contact and pressure over the wound, wrap a pressure dressing from distal to proximal. Assess distal circulation to ensure that the bandage was not applied too tightly. The intent is to maintain control of the bleeding with continued pressure. If firm, consistent, direct pressure fails to control the hemorrhage, a tourniquet should be applied. A tourniquet can be any material 2 to 4 inches wide that can be wrapped tightly around the extremity, but commercial devices are the most successful tourniquets because they have a built-in windlass that allows for proper tightening and continued constriction of the band. Apply the tourniquet at least 2 inches above the wound site and tighten as much as possible. Twist the windlass until bleeding has stopped and distal pulses are no longer palpable. If the tourniquet is not applied tight enough, it will actually increase venous bleeding, similar to when a constricting band is applied for blood draws or IV initiation. For very large or muscular patients, 2 tourniquets placed next to each other may be required to control hemorrhage. Secure the windlass in place with a strap that covers the windlass, ensuring it will not release the tension you have already applied. Document the time the tourniquet was applied. Some systems want this information literally marked on the patient's forehead so as not to be missed. Now that the hemorrhage has been controlled, you can begin to treat for shock. Appropriate treatment for shock includes properly positioning the patient supine, maintaining the airway and administering high-flow oxygen, reassuring the patient to reduce anxiety, and preventing heat loss by applying a blanket. Prepare the patient for transport and monitor vital signs.